Welcome to the Medical Ancillary Sales Podcast, your number one source for making money in the medical ancillary sector. Mike and Viv bring you the latest information from lab services, pharmacy, diagnostic testing, and so much more. The latest in ancillary services will be right around the corner. Welcoming the hosts of the Medical Ancillary Sales Podcast, here's Mike and Viv.
Hello and welcome to the Medical Ancillary Sales Podcast. I'm your host, Michael Berg, and joined as always by Viv Hudson, and it's just going to be me and you today, Viv.
I know, how exciting.
Hope you don't mind being on the spot. I'm going to be putting you on the spot a little bit because we have had a lot of interest. Really, we've had pretty, I would say, consistent interest in different equipment that we sell, specifically as it pertains to the ANS. And it seems like we get consistent phone calls and consistent inquiries from doctors about that device. But there are some nuances between the devices. I know you have some personal experience with it. I know you just sold one, so you are probably knee deep in it, and you've sold these devices for a while. And there are some nuances. So I think what would help people would be to kind of understand those nuances between the devices and understand how to effectively sell this to doctors, because it's a great commission that you get off of it. So first and foremost, there are two ANS devices. What are the differences between the two?
Right. Well, the original is, because it's still available, is the ANS device. It basically has foot plates that the patient places their feet on. It has an oximeter that the patient wears on their finger and a blood pressure cuff. The test takes about 7 minutes to perform, where the patient will have 2 minutes where it's just doing their resting readings. And then they'll do a Valsalva maneuver. They'll do some deep breathing. And then they go from sitting down to standing up. So all those different things produce quite subtle yet distinct variations in what we call the heart rate variability. And depending on how the difference in how the heart rate responds will determine the patient's risk for various metabolic disorders and particularly autonomic neuropathy. Now, autonomic neuropathy is one of those conditions. It can be a little bit hard to distinguish between that and artery disease. So doing this particular testing is of quite good value in various settings, but that's one of the differentiators that they're looking for. Now with the TMI flow, that's been available, I believe it just came out at the beginning of this year. It's essentially very similar, the equipment, except instead of the metal foot plates, they are using gel electrode pads on the patient's foot. And the patient is also wearing a blood pressure cuff on each ankle, as well as on their arm, and then also an oximeter as well. And the patient commences the first part of the test, and they recommend that the patient is lying down in this particular instance. But then they go to a seated position and do the same breathing exercises that they did with the ANS. So it still takes only 7 minutes to do.
That was going to be my next question. And does an MD have to perform this? Can an assistant perform it? Or?
No, it's quite simple for a medical assistant who is trained how to use the device. So the device actually has a talk through, so it tells what to do with the patient actually from the piece of equipment. So it's very easy to learn, and it can be also guided. We can provide training via Skype or over the phone to assist getting that patient, getting the office up and running with the equipment. But it is pretty straightforward.
And what are they trying to get to? What is the doctor diagnosing? Why would they want to do the ANS test?
Right. The ANS test, I mean, it's one of those kind of silent diseases. And I mean, you go to the doctor routinely, they take your blood pressure. Routinely, they take your heart rate. They'll listen to your heart and your chest, and they're very simple tests. But if we start looking at how the body is wired, that's a little bit more difficult to do in a simple setting without this kind of equipment. Now, when we're looking at disorders of diabetes, now, when people have diabetes, they typically have elevated blood sugar levels, and depending on how well they control their diabetes or how early they commence treatment, there can be damage that occurs to the fine nerve fibers that are in people's hands and feet, but also to their body organs, such as their kidneys, their eyes, and their heart. So from that perspective, it gives the doctor like a good insight into what's going on with those particular nerve fibers that they wouldn't be able to do by just testing somebody's blood pressure or taking a blood test even. It's just something that wouldn't show up.
Yeah.
So it's very valuable.
Yeah, it's like it reminds me of getting your car service. Like back in the old days, it was we check the dipstick and see how your oil looks and maybe kick the tires. Whereas this is now taking it a step further, and it's like when you get your newer car service where they plug it into a computer and run full diagnostics, and they could tell you exactly, to more degree of specificity of what exactly is going on with the overall system. So it just it gives them the tools they need to be able to properly diagnose and treat the patient at the end of the day. I mean, that's what a lot of these things do, but that's what it sounds like to me. How about for the patient? I mean, what's the benefit to the patient?
Well, to the patient, one of the beauties of the report that comes out of these particular devices is that it's very easy to interpret, and it's color coded as well. So from anybody's point of view, the first step in change is always creating awareness. So if we don't know that there's a problem, then how do we fix it? We can only guess that there might be a problem. Well, that's not as motivating as when we can see what's green and looks good and what's orange is perhaps starting to show that there is some signs of damage going on there. If things are caught early, there can be some improvement. But if things are left to the state where a patient is getting a lot of red coming up on their report, then that's showing them that, there's probably very little that can be done to change some of those outcomes. So from the patient's perspective, it very much does highlight awareness. And also, like when I've done this particular testing with the patients, they've actually thanked me because they've found the test very palatable in the sense that it's not invasive. And when we're testing people for peripheral neuropathy and they're poking them with, like, let's say a blunt version of a pin,
or like in the ENG tests, which are also done by neurologists, and I've heard those are very painful tests with needles going into the muscle.
Yes.
And electrical currents being ran. I mean, it sounds like a science experiment from a Stephen King book or something. But
yeah. Well, certainly it's not a total replacement for that because these are different fibers that we're testing to some of those ones that a neurologist would be testing. So some of that is still required, but certainly it's a lot less invasive, and it can be a first point of call to do a test like this, as opposed to going for those nerve conduction studies. But the main thing is that this can help to be a differentiator between autonomic neuropathy and peripheral artery disease.
So who's buying this? I mean, I hear diabetics. I'm obviously thinking anyone in the primary care setting, endocrinology, any other specialties that you see that are deriving value from this device?
Absolutely. Definitely like your internal medicine, geriatric type physicians, endocrinologists, and neurologists are also finding values. And even pain clinics actually have found some benefits to this particular device. So sometimes some of the questions that doctors will say, well, so what? I can test this now. Now what? And that can be one of the objections that somebody selling this could get. But basically, it does give you some differential diagnosis. It gives you a level of detection of risk, particularly in the internal medicine setting, to see, particularly if a person's newly diagnosed with diabetes, to give them a baseline as to has there been any nerve damage. And I don't remember the statistic now, but I want to say that it maybe was up to 40% of people that had once diabetes was diagnosed, that there was a potential for some kind of nerve damage already at that stage. So that, the key is early detection. And
as is with many of these, it seems like we talk about that all the time. How does a physician determine medical necessity?
So any patient, my personal opinion is that if you have diabetes or a risk for diabetes, you should be able to test for this, but unfortunately that is not the case. So we can't just blanket screen all patients and expect to get reimbursed on it. So there's got to be some need for medical necessity. So if the patient is experiencing any pain, numbness or tingling in their extremities, or if they're experiencing any dizziness, even different disorders such as heartburn can indicate that there is autonomic disorder. So there's quite a number of, if you talk to probably 80 or 90% of your Medicare population, they're going to have one of the number of conditions or the symptoms that are described that would enable them to do the testing. So it's going to be quite easy to demonstrate that need for those patients.
Viv, this is great information. These guys, doctors are looking for these, and as we get into the fourth quarter here, there's a few different ancillaries that, as we get into the fourth quarter, would be my go-tos. Obviously, we've spoken before about the respiratory panel. We've talked about that ad nauseum. We're hitting the season for the respiratory panel, but we're also hitting the season for equipment purchases, and that's because there are tax benefits for the physicians to be making these sorts of purchases right now. This lowers their taxable income. So don't be afraid to push this, and don't be afraid to talk about the tax benefits too. So Viv, thank you. Great information.
Excellent. And thank you, Mike.
All right, take care.